I'm curious about, and this isn't something that we've talked about at all. I'm curious about COVID and the likelihood of practices losing people that are maybe the only people in the practice that know how to do the billing, and where that plays in now, because I know that there's just staffing shortages are real in healthcare, like they are in kind of everywhere else. But you kind of have to walk this fine line where it's like, we're not there to replace anyone of the family. We recognize the practice is a family, but we do recognize that staffing shortages happen. And we want to make sure we're there for you in the case that happens. So how is that still kind of the mentality in a lot of the kind of smaller physician practices, is that it's family, but sometimes in family, I guess things can go wrong. You can,
That's right.
Something can happen and you're going to need somebody to help you with, some billing expertise that walks out the door.
Very well said. I would say that's 100% accurate. We always want to make sure that we are in tune with each practice as an individual practice, that we understand the nuances client by client. And that's from a 1 doc practice or to that 45 doc practice that I mentioned. It's really important that we forge that relationship strongly, and we augment our services and grow with the practice. So if there's a need, we develop sort of a plan, practice by practice. We've augmented our services to include charge entry, fee analysis, chart analysis, things that are outside the standard contract, but we're happy to step in and do on behalf of the practice. We've had some practices that have a fear of an audit. Things have changed with coders in-house. And staffing in-house. And we had one practice that went into a chart audit, reached out to us and said, we're struggling. We're getting audited by Medicaid and it's a heavy fine. Can you help us out? So we did a pre-audit for them and found exactly where things were going on. Made some recommendations, and they were initially going to be fined just shy of $250,000, and that was reduced down to $13,000 based on our recommendations and findings.
Oh, wow.
So offering services that can help, and this was a 1 doc practice in rural Vermont. So, that mattered. That would have closed the practice down. So we those are the meaningful things that we can do. Like I said, chart audits, not only just in an emergent case like that, but, just to make sure that they're capturing all of their revenue on a daily basis.
Makes sense.